Have you ever gotten Botox and noticed that your smile is affected? I'm Dr. Sarah Allen, Chief Medical Officer of the Skin Clinic, here to break down why that might be happening. There are 4 reasons your smile could be affected after a Botox treatment. You have 2 sets of muscles that run just from your cheekbone all the way down to the corner of your lip, just like this. These 2 muscles are called the zygomaticus major, and just a little bit towards your nose, you have one called the zygomaticus minor. When these muscles are inadvertently hit, you lose the ability to raise the corner of your mouth. And so if you notice that your smile is affected in this way after Botox, that's likely what's causing it. This is more difficult for an injector to hit. This muscle is very deep. If you can you feel your cheekbone. That muscle originates or starts all the way on that cheekbone. And so this is a more difficult one for an injector to hit. And if they do, they're injecting too deep. Number 2 is the same muscle that we inject for gummy smile. It's called the levator labii superioris aliquot nasi. How's that for a name? The levator labii superioris aliquot nasi is responsible for elevating the top part of your lip. So when you get Botox here, it actually relaxes your smile. So for patients who have a gummy appearance, right here is what we call it, we can treat that muscle and drop the smile a little bit so that your lips cover your teeth. But you can imagine if you get too much in this area, your smile is affected and your lip may actually be just as low as your teeth and you may not be able to raise above that. It's one of the reasons I always recommend starting low and going slow in this area. The third way that your smile can be affected is when an injector hits the risorius muscle, is what we call it. This is a very superficial muscle that runs from the masseter, which is a large, square, broad-based muscle, which allows you to chew, all the way to the side corner of your lip. This is a very superficial muscle, meaning it's just beneath the surface. And if it's hit, you lose the ability to pull the corner of your mouth sideways. So sometimes this gives patients the appearance of a grimace appearance when they smile. This area is typically affected if you have a provider who's treating the masseter muscle and they're too superficial, or you get Botox diffusion to that tiny little muscle. So occasionally that can occur. The final way that your smile can be affected with Botox is if your provider inadvertently hits the depressor labii inferioris muscle. This is a little curtain-shaped muscle that sits just below your lip, and it is a medium depth muscle. But if Botox inadvertently gets in this muscle, you lose the ability to pull your lip down. So see, when I smile, see how I can pull that down? If that muscle is affected, you can't pull it down anymore. So you smile, and one side is up because it won't relax, and one side is down. And sometimes patients feel as though they look like they've had a stroke. How can your provider fix this? Well, they can give you a little bit on the opposite side to even out your smile, but rest assured, typically these treatments are lower doses. The mean duration of action of Botox is 75 days. So if you think about it, at a lower dose, you're probably looking at 45 to 60 days of a changed smile. Your provider can always fix this by giving a little bit on the other side, but it does take a very experienced provider to diagnose what exactly is going on, which muscle is affected, and how it can be treated. If you want to hear about other Botox mishaps and other healthcare topics, like, subscribe, and share.